My name's Jenny Smith. I'm the CEO of Victoria's Homelessness Peak Body, the Council to Homeless Persons, and I'm delighted to welcome you all here and thank you all for being here today for this very important event, which is part of our National Homelessness Week. And what an opportunity we have to hear about the legislation in Wales that has shifted their approach away from crisis and towards prevention, and talk about what that might mean for us. I don't want to go any further without acknowledging the traditional custodians of the land on which we're meeting today, the Woiwurrung and Boonwurrung people of the Kulin Nation, and pay my respect to elders past, present, and any who are here with us today, and note that these lands were never ceded. Now, today's event is a very exciting partnership between Unison Housing, two bits of RMIT University, the Centre for People, Organisation and Work, and the Social Global Studies Centre, and Council to Homeless Persons. And it is fantastic to have such a turnout. I think we're going to have a few people drift in, so I'd ask you just to tolerate that, but there should be about 165 of you here by the time we get completely underway. And people are here, I think, to hear from our guest presenter, Dr Peter Mackie, and we will then have the opportunity to unpack the implications of what he's got to say for our own situation here in Australia. So it's wonderful to see so many colleagues and partners here, but I would like to particularly acknowledge our Lord Mayor of Melbourne, Sally Capp, who's already supported us this week and the week before. Thank you very much, Sally. We may have the Leader of the Greens in the Victorian Parliament, Dr Samantha Ratnam, join us. The Deputy Mayor of Moreland, Councillor Mark Riley, and the Deputy Mayor of Darebin, Susan Newton, as well. But thank you all for taking the time to be here, I think, for what should be a very stimulating presentation and discussion today. So, to cut to the chase and introduce Peter Mackie. Peter is a senior lecturer at Cardiff University in the School of Geography and Planning, and his research is on the development of homelessness policy and law, particularly in relation to homelessness prevention. Now, Peter's CV is long for someone with such a youthful demeanour, but perhaps most notably for us, he led the 2012 review of homelessness legislation in Wales that formed the basis of the pioneering Housing Act in 2014. So Peter's current research includes a second phase of exploratory work relating to housing rights and Welsh homeless law. And we are very, very happy that Unison Housing and RMIT, through Guy Johnson, have brought Peter to Australia at this point in time. And I'll let you know that Peter has been given licence to speak for 30 minutes. And then we will have a good discussion. So would you please join me in making Peter welcome?
Right. Youthful demeanour. I've got two kids. You can't keep a youthful demeanour with a 9-year-old and a 7-year-old. Right. Let me start. Wominjaka. Is that correct? Wominjaka. Wominjaka. Pronoun da. Where's my fellow Welsh colleague? That's good afternoon in Welsh. Wominjeka, I think, is an Aboriginal language. So that's my attempt. And I didn't know there was going to be a fellow Welshman in the audience. That's the extent of my Welsh. Sorry. Right. So, firstly, thank you for having me here. It's important to start off with the thanks, because when I start talking about the law, the legislation, homelessness prevention, housing rights, I will forget everything at the end of those thanks. So I'm going to start with Guy and Unison, who got me out here. And Guy's a long-standing colleague. And there's a wonderful network of this kind of collective. I don't know what the the word is for a collection of academics who are like-minded, that get out of the ivory towers and like to see change. And it means that we don't do enough paper writing, but we go about, bring about change and sharing our ideas. And this is just an ongoing part of that. And Unison Housing in particular, for sorting the funding to get me out here. But it's also worth reflecting that collaboration between Unison, RMIT, and also now with CHP, bringing that collaboration together is really something quite special. And you know, you would take it for granted that happens with some of your academics here. That's not normal. You know, most academics sit in an ivory tower and don't come out and don't engage. So it's worth reflecting that there's some good stuff going on here. Right, so without further ado, I'm gonna begin. It's quite awkward. I feel in Wales, if you give somebody a microphone, we start singing Tom Jones. If I dare, call me up on it. Right, here we go. With this sort of mic. So what are we going to do? A little bit about the talk. We're going to talk about homelessness prevention. So the first thing to do is just put on the table, what are we talking about? What do we mean when we say homelessness prevention? So I'll spend just one slide talking about that. It'll feel a little bit like Homelessness 101, but we'll do that. Then just question why it is in the Welsh context and globally that we might want to shift towards prevention and a rights-based approach. I'll then spend a good bit of time talking to you about what we've done in Wales, this Welsh duty to assist, and then reflect on how it's going, what's working, and then I'll spend a bit of time talking about, actually, here's what we could be doing better. Here's what globally we might be doing to improve that framework and that law. And the caveat is, you know, when somebody comes over and they say, oh, we're going to learn what the Welsh are doing that's so wonderful, you know, it's not perfect. And I am in no way telling you and standing up in front of you to say this is perfect. But we did, for once in Wales, where is he? Get something right. And we know we got it right because the English copied us. That never happens. Yeah, it goes Scotland to England to Wales and we get left. We got it first, right? So we must have done something right for the English to copy. And I'll raise that question at the end that says, you know, could we have a duty to assist in Australia? I'm going to give you no answer to that question. That's over to you guys. You know, you can't come to a country and say, here's how you should do it. And this is what's happened in Canada is we went over and we've had these conversations. And now they've started to say, well, here, yeah, this is what a Canadian duty to assist might look like. And they've started from the community up to really try and work towards those principles. So it'll be over to you guys to then open up that discussion. So that's what we're going to do in half an hour, and all academics are wonderful at keeping to time, so it won't go over at all. Right, so defining prevention, a five-type typology. So firstly, universal prevention, and that's essentially let's deal with poverty. Let's make sure housing markets work. Yeah, if we can get those right, we can have our greatest impact on ending homelessness. We're a long way off successful universal prevention. Targeted prevention, that's with groups that we know are at risk of homelessness. So, for instance, folk leaving institutions, whether that's care, prison, hospitals and health. So we can make targeted provisions and interventions. Crisis prevention, and this is where most of the homelessness legislation in Wales sits. Yeah. We define it when we talk about crisis prevention as 2 months before somebody's likely to lose their property. So we're not hitting the streets, we're intervening early, but it's still crisis. That's where the Welsh legislation sits. And then we talk about emergency prevention. That's night before somebody's hitting the streets. That's we've just got to do something to stop somebody sleeping rough. And then recovery prevention, which is the most tangentially relevant of all of these, is basically let's stop folk becoming homeless again. Now, arguably, these two really shouldn't be in a definition of prevention. I see a lot of heads nodding, going, why on earth did he put them in there? Look, it's in there. It captures the whole suite of things that we do in the home sector. But it's important to recognise, look, this is the majority of where we work. This is the majority of our activity, our funding, our services. Yeah, and by using this framework, it lets us highlight that and say, hold on, we need to shift things up. And that's what we've done to some extent in Wales. Right, so why do we need this new prevention approach? I suspect your homelessness figures look something a little like this. These are our figures. This could be a graph of most countries globally. Yeah, we've got all these services. We're funding homelessness services year on year on year, and we're making no impact on those homelessness numbers. It needs a new approach. You cannot keep doing the same thing and expect change. So that's one reason why we said, actually, look, we've got to change what we're doing. We also, in Wales, and this was a UK system, had basically an all-or-nothing emergency service. We waited till folk became homeless, and then we had a wonderful piece of law that said, look, if you're homeless, we will give you a council house. Do you know what a council house is? Yeah? Because you use so many different terms. I went to Guy's lecture this morning. I was like, you've got like 4 terms for council housing. Yeah, social housing. You got a social house for life if you were homeless in Wales. Is that good or not? Shake your head, nod your head if that's good. Yeah, that sounds fantastic, doesn't it? But we haven't got enough council houses. So we're going to prioritize. We do prioritizing so well in the homelessness sector. Who are we going to help? We've got millions of pounds in the US, dollars in the US is spent on deciding who we should prioritize to get that service. Academics have made careers on deciding who we should prioritize. And we had that, so we prioritized, and we prioritized families. If you had children, you got into our system. But also, if you were incredibly vulnerable, and I mean incredibly vulnerable, with the most awful conditions, then you got into our system. But that was a system that basically was an emergency service, all or nothing. We needed something that was fair and more socially just. And so that's what we set about doing when we reviewed the legislation. Now, globally, you know, Wales isn't the first to start thinking about prevention. It's been around for a long time. But globally, there are a number of challenges when we start looking about what we're doing around homelessness prevention. The first of those is that, look, where we've got services, we've not fully oriented the system. Yeah, they're kind of a little bit here, a little bit there, but the majority of our money is still going to be spent on chronic homelessness. Even in countries where we've got the provision, you get huge, or some provision, you get huge geographical variation. And that's particularly true in federated states. Then selectivity, and this was one of our key problems, and will be a problem unless you have a really good regulation or law, that actually we pick and choose who we want to do our prevention support with. And that was happening in Wales before we changed the law. And who do you think they were choosing? Who would you choose to help? Or who would you choose not to help? Go on, chuck some at me. I'll see if you're right or wrong. Academics are told, never tell them they're right or wrong. You could be wrong on this one. Right, go for it. Come on. Who would you choose to help? If you're selecting for prevention.
The hardest to help, the most disadvantaged, the compound sets of problems.
Interesting, yeah. So often, that's true, and it was part of our legislation, but in prevention services, actually, when you look across the globe, those with that are actually hardest to help often don't get the prevention assistance. So in the US, that's what happens. We don't see the hardest help getting the prevention help. You might get the chronic homelessness support, housing first, etc. But the prevention stuff is not happening. Often what we see is we pick the ones that are easiest to. And in the Welsh context, the folk that were being helped were the families, because we knew that we were going to owe them a duty to a council house. So we thought, oh, we can save money if we prevent it. But the singles were getting nothing. Yeah, so single people were just getting nothing in our system. And then finally, that even in places where you've got those services, it is never a requirement that those prevention services are provided. So for all those reasons, we said about changing the law in Wales, and we came up, I should say, we've called it the duty, it's commonly referred to as the duty to assist, but only outside of Wales. Nobody in Wales uses this term. I blame the Canadians, because I gave a talk and the Canadian was like, oh, Pete, I heard you talk about the duty to assist. What's that? Your legislation, but it's now taken hold, and actually, you know, just embrace it. If that's what explains it and makes it intelligible, rather than the Housing Act Wales 2014, great. We've got the duty to assist. So that's what it is. And I'll talk you through that. So the Housing Wales Act 2014, what does it do? It attempts to prioritise homelessness prevention, reorienting services, funding, etc. And how does it do that? So we make access to prevention services a universal right. That's the step change. We totally reject the assumption that says we've got to identify who we're going to prioritise. That's a huge decision. Yeah, we're going universal. Everybody will get this assistance. And it's the minimum assistance required to help you keep your home or find an alternative. But, and this came about, the research that led to the change was really participatory. You know, everyone was involved in the sector. Folk who'd experienced homelessness, folk providing services, local authorities, etc. And actually what came back to us was the message that says, look, let's bring prevention into the law. We need, and this was their words, we need a duty to prevent. That sounds great, doesn't it? A duty to prevent. You can't do it when you actually sit down and think it through, because you're going to fail sometimes, and then you've broken the law. Yeah? And there's nothing more that drafting lawyers hate than something that can't be implemented. I hate drafting lawyers. Yeah, you come up with these great principles, and they can't turn it into a law that works. So what we did is we came up with this concept of reasonable steps, or it's a concept that exists in law. So, rather than a duty to prevent, you've got a duty as a local authority to take steps, reasonable steps, to assist somebody, to stop them losing their home, or to find an alternative. Now, this is also what makes it so palatable, because you're not saying, I've got to guarantee you a house anymore. Right? I'm not guaranteeing you a house. All I'm guaranteeing you is if you come in and ask for assistance, we've got to help. We've got to take those reasonable steps, which also makes it a transferable policy. You can do this in Somaliland. Yeah? Because you're doing it with the resources that are at your disposal. Yeah, you're limited to those, but you've got to take those reasonable steps. So that's the wording within the law. But also the change was we used to have a system, like most countries, that says this, when you enter our services, this is what will happen to you. Yeah, we've got a linear route. This is what's going to happen. The law says you've got to look at the individual's needs, yeah, and respond to them as an individual. And you've got to have a whole suite of interventions at your disposal in order to meet that individual's needs. And I'll list those in a second. How do we define a prevention? Oh, this was a good one. There's lots of debate on this across the sector. And actually, we defined it as, look, you find somewhere that somebody is likely to keep for 6 months. Hands up if you think that's a good definition of prevention. Hands up if you think that's a bad definition of prevention. Hands up who's already fallen asleep. You've got to have a view. Come on, if we're going to change this, you can't sit laying back on your chairs. I was promised good audience guy. Right, it's not great, but 6 months was deemed as adequate because that's what the market promises to any lay person. If you are looking for a private rented tenancy, that's what you get. So it actually removes the moral hazard in some homelessness systems that say, oh, well, people will become homeless in order to access this wonderful resource. That happens. That's in our parliamentary debates, that rhetoric. All you're getting is a step up back into the housing market. Yeah, that's the prevention. It has its limitations. Now, right, they had better participate on this, right? I've done this with my undergraduate geographers, and they've even participated in this one. So, if I say right, some words just come in pairs, don't they, hand in hand. If I say rights, what sits alongside the word rights? I've got a lawyer, rights and, I'll tell you, it begins with a R. Rights, well, yeah, right, bonus money. If there's wine afterwards, you've got the wine. Rights and responsibilities. Yeah, they go together, hand in glove, hand in hand. So it makes sense. If we're going to extend these rights to folk, they'd better take responsibility for their actions. And so this little bit of the law snuck in that wasn't something we recommended. That actually, if you're going to come and get assistance, you've got to cooperate. So there's an expectation of cooperation. And if you don't cooperate, I can discharge my duty. I'll let you ponder on that, whether you think that's a good thing or not. Right, so this is the list that's in our statutory guidance of the interventions that we ought to have, local authorities ought to have in place. Hands up, my lawyers in the room. Lawyers, hands up, don't be shy, hands up, right? The word ought, I hate it, right? I argued for so long. What should that say? Ought, what should it say? If we want local authorities to do it, must. Oh, we fought, and I lost this one. And it says ought, and it means that actually we don't address all the geographical variations that we wanted to, because you ought to have it, which basically means in law you can get away with kind of not having it. But we've seen local authorities develop a whole suite of these different things that range from family mediation through to all sorts of rent subsidies, etc. But they ought to have these in place. So what's worked well? I better fly because I'm already going well over what I said I'd do. So a couple of things. Look, this part of the legislation didn't exist before. We've got nearly 11,000 households getting assistance under that part of the legislation. Now that's a success. That's folk we're working with earlier. You know, some of the families we were working with, but the singles were getting nothing. Yeah, so that's a grand success. But we're still getting quite a few folk that are coming into this second stage, which is where you are already homeless. There's still a duty on the local authority to take those same steps. So that's the first point to make. The second point to make is look at this prevention stage. In about 70% of cases, we're successful in preventing homelessness. You can clap if you like. That's a good one. Yeah? Don't joke, I'm joking. Yeah, yeah. That's local authorities, their partners, government coming together and making it happen. Yeah, taking the law and actually implementing it and leading to success. And we talk of numbers, 70%. Each single one of those is a person and they've got a story. Yeah, and as academics, we get so caught up in these stats, but every single one is a life, is a story, is a reduction in trauma. Yeah. Now, here's an important point. 40% success rate, roughly, when we get to the relief stage. And that's an obvious outcome because you've got an extra solution at the prevention stage. You've got the option of keeping somebody where they are. Yeah, and that's where we see the greatest innovation. But it's an area that we've got to work on. We're not successful enough. I'll also just highlight, I haven't circled it, look, those blue bits in the middle are other, the bits at the top, purple, are other outcomes. You know, we could have presented these stats and ignored that other. They're folk that we don't know what happened. They kind of disengaged from the system. But we did win the battle to make sure that Welsh Government recorded that, and they were very happy to, because it highlights, well, what's happening to those folk? Are they self-resolving, or are they just disengaging from the system because the system's not good enough and not offering what's needed? And so we're exploring that. We're trying to find out what's going on there. Right, so here's another one. I love this slide, and I'll tell you why. After year one of the legislation, this slide used to go in my next section of what we need to work on, what we need to improve on. And now it makes it into my slides that says, look, I think this is working quite well. If you remember, I said the old system favoured families, single people got nothing. In our prevention stats, we're at nearly equal in terms of success. When we started implementing the law, there was a legacy of the old legislation, a legacy of old practice where, look, we just weren't succeeding in the same way with single people. And local authorities and their partners have turned that around. Yeah, they've upped their game, they've found new solutions. That's a real success for a system that really, did ignore single people. We're not quite so successful at the relief stage yet. This is the last slide on success, and it's a really important one. It's about service culture. And this isn't an accident. When we develop the law, and it's written into the guidance that says, look, we're looking for a culture change. This law isn't just about just changing practice. It's about changing the culture of the entire sector, those that challenge, those that are delivering services, etc. The first one is a quote from a practitioner, and the second one is a quote for somebody that went through the system, the old system, homelessness, repeated, and came back in through the new system. And I absolutely love this quote, so I'm going to read it to you. It says, right, excuse me, because there's some English language in it. I hope it translates anyway. This time round, it's been totally different. Before, I would have had to take my sleeping bag and my flask because you'd be there for the duration of the day. The staff would have faces down to their arses, in and out of rooms moaning, This time, totally different. They speak to you on a personal level, a better basis. And it's just an indication of that culture change. So you had staff whose job it was to exclude. Are you in the system or are you not? You're not in the system. That was my day job. That's not a pleasant job. Now we've got a job that is, I've got to try and find you both a solution. Yeah, it's a total culture shift. And that's what comes from universal services. We're not trying to exclude or decide who gets in. Okay, so the culture shift is there. Right, how could it be improved? I could probably lecture about 6 hours on this one. it's not perfect. There's loads more we can do. Now, the first point is to say, you saw how much more successful we are at the prevention stage than if somebody is already homeless. So we need to get more folk in earlier. Yeah. So how do we go about that? Just a couple of things. We recognised this when after year one we could see that pattern. So when England copied us, did I tell you England copied the law? Right. When England copied us, they learned from that. And this is what you guys, if you copy any of this, do it. Just keep making improvements. And they put a duty on other public bodies to refer in. If you think somebody's at risk of homelessness, you've got to, by law, refer them in. That's amazing, because that's cross-departmental action on homelessness, which is quite rare. So England have learnt and improved. And the best thing is, prisons are not devolved. So most other things are devolved to Wales, but prisons aren't. So now we get prisons phoning up local authorities in Wales saying, oh, we've got people who we're discharging and they're going to be homeless. We're notifying you, so can you assist? And they're not under any duty to do that to Wales, but they're doing it because the law has changed in England. So that's one thing, to increase referrals, we should be doing that. But also there's some really interesting practice in the Netherlands, in Sweden and in Austria, where you've got either a duty to refer to the local authority when somebody gets into rent arrears, or at the more crisis end, if they're about to be evicted. It's just about making sure that we're aware of folk when things are starting to go wrong. We don't do this yet, but that's the sort of thing that we're now starting to look at. We could say, actually, other public bodies don't just have to refer, they actually have a duty to prevent. And I think that's going to come up in our discussions about the role of other agencies. One of the things our public housing bodies might be challenged to do soon, and our minister has said she's going to look into it, is a policy of zero evictions into homelessness, because our social housing providers are still evicting folk into homelessness. Where else do you go? And earlier identification, and this is where we're already learning from you, and our minister is committed to pilot the Geelong project, which I went to visit on Tuesday, where you're basically identifying young people at risk at a very early age and intervening through family mediation, etc., through schools. So all of these things will help us identify folk early and would improve the implementation of the law. But also, in our latest round of interviews with frontline staff and folk using the services, there are a number of issues coming out around how the support's being provided. Basically, the caseloads for staff have been too high, so they're not being able to spend enough time with individuals and do that really intensive hand-holding, one-to-one support that the law intends. So we need to look at that. That basically means if you're going to make these changes, you've got to fund them. Yeah, you've got to have enough staff there. We've had a couple of naughty authorities that have started to time limit support. You can't put a time limit on how long it takes to end homelessness for an individual. And you've also got to accept that they might come back because the trajectory out of homelessness isn't linear. So we need to make sure that we're not limiting services, for instance, 12 weeks as one authority was doing. And then also this reconsideration of our cooperation duty, because we know that's being misused. So there's some issues around support. Oh, here we go. Right. Oh, I may have just right. Is that still up? Yeah. Bad bureaucracy. Now there is, when you say the word bureaucracy, everyone goes, "Oh yes, we hate bureaucracy," because we use it in such a pejorative way. Bureaucracy can be a really good thing when you're using the law. You need a bureaucracy. You need a paperwork because you need to be able to prove and demonstrate and make sure that folk access their rights. But we've created a little bit of a monster. Some of our paperwork is hell. I wouldn't understand it. And certainly if you're going through a homelessness service and life is falling apart around you, you don't need a letter that says Section 73 of the Housing Wales Act 2014 requires that. We've got to get past that. So that's one that we've got to beat. But more cynically, some of our paperwork, we introduced this, and we introduced something called the Personal Housing Plan, which basically says, here's what we as a local authority are going to do, here's what we can do, you can put your voice into what we're going to do. So it's a collective discussion. Some of that paperwork that was intended to bring about transformation and choice and control for the individual coming through the system is being used to say you didn't cooperate, you didn't do what you said you were going to do. And that's not part of the law. That's not what we intended. So there's things emerging. Right. It was the best picture I could get of happy staff. It's just like looking out at all of you guys really at the moment, except for rows 5 and 6 who are half asleep. Right, investing in staff. We didn't do enough of this. Yeah, we just expected our frontline staff to come along, and it was actually a big change. And so there's a couple of points to make, is if you do this and you transform services in that way, expect a big turnover in staff. Yeah, we lost a lot of people who couldn't work in that new environment, who weren't problem solvers. They were folk that could run the bureaucracy. We also had new, so some local authorities saying, actually, what I need is estate agents, because most of our solutions are in the private rented sector. I need folk that can go out and get private rented properties. So we start employing folk from estate agents and bring them into the council. But also, what we've had in the latest round of interviews is staff saying, look, this is traumatic still. You know, we're working with folk, we're going through traumas as well as the folk that we're supporting, and we need a professionalisation of the service, more like social care. And we haven't been doing that in the homelessness field. So there's a lot of work going on around investment in staff now, and actually how we recruit people. Okay, you can't solve homelessness without housing. God, that was going to be such a good tweet, and I messed it up. I should write notes. Damn it. Let's roll that one back. Right, okay. There we go. You can't solve homelessness without housing. Right, you can't. Yeah, we've got you've got to make the housing available. Otherwise, you're not gonna make the inroads that you want to. The caveat to this is when you bring something like this in, they will always say to you, "We don't have the houses," and they said that to us. And do you know what? The best example I've seen is where a mental health charity got a small project to help in delivering some of this system. Had no experience of housing. They were a mental health charity. That raises questions about commissioning, but anyway, they got the work, and the guy just said, well, I need private rented properties if I'm going to support these guys. Went out, found landlords that the local authority had no idea about, supported the landlords to the extent that the landlords then phoned him up to give him properties, yeah, and tells the friends who've got properties, look, actually, they'll look after you, they'll make sure that the bills get paid, etc., etc. So sometimes there's stock out there that we're just not getting access to. Right places. Sorry, I forgot to say that. So housing in the right places. So sometimes we're making offers and actually those properties just aren't in places that folk are going to sustain. They don't want to be there. Right, this is the last point. In Wales, our government, we have a light touch approach. There's nothing wrong with that. An approach that says, look, local authorities, you've got the duties, now go on and do it. But we didn't bring in a regulator, and that was one of our recommendations that we learned from Scotland. We don't have a regulator. We've been fortunate that the world's eyes have been on the law, so there's been some extra scrutiny from government, but we need something that's better resourced and with teeth to actually hold to account those local authorities that are perhaps misbehaving. And also, when you talk now to local authorities, they're saying, we want to know if we're doing it right. And actually, if somebody else is doing something else that's quite innovative, we want to be told. So there's a role there that we've not filled. So a duty to assist in Australia, all I'm going to do is repeat what I've said. Look, it's not perfect, but the duty has reoriented services, and it seems to be having some positive impact. And we talk about a right to housing. I'll flag this now because you might say, well, hold on, he said he was going to talk about a right to housing. You can have a constitutional right to housing. Loads of countries around the world have got one. And all you've got to do is say, we're making progress towards it because we're building 10,000, 20,000, 200,000 homes. Box ticked. That's progressive realisation of the right to housing. What this does is it's a far more concrete progressive realisation. You're actually tasking local authorities with taking steps for the individual. Yeah, this is real progressive realisation of the right to housing. But there's loads more we can do. We can do look at getting more folk in earlier. We can invest more in our staff. We need to look at, the conundrum of rights and responsibilities. Actually, to what extent do we want to be placing these sorts of responsibilities on very vulnerable people? The importance of housing, and also just that idea that legislation alone isn't going to fix the problem. I'm going to end on, because otherwise I was going to end there, and it's just not a good enough ending. I'd like to look at other languages. You've heard the extent of my Welsh. And so I looked up a saying, an Aboriginal saying. And I was trying to, is there anything on prevention? They must have had something on prevention. I'm sure there is, and I'm just not familiar with it. But there was a really good one about innovation, a phrase that said, look, or I interpreted it as innovation. And it says, look, traveller, there are no paths. Paths are made by walking. And I interpret that as saying, sometimes the evidence isn't quite there for what you're about to try and do. Just go and try and do it, then evaluate it. Yeah, and as researchers and as practitioners, I think there's something to be taken from that. Yeah, sometimes the path's not there. In this case, you have actually got a bit of a path, and then make your own, make it a bit better. Diolch yn fawr, thank you very much. The law says you can discharge your duty if somebody fails to cooperate. And it's being used by some local authorities, and they're actually using the phrase, you've got a duty to cooperate. Now, the law doesn't say there's a duty to cooperate. But there's also a clause in the law that we managed to get in when they introduced that said, but you've got to take into consideration people's vulnerabilities and support needs in making a decision that somebody's failed to cooperate. So simply saying that somebody didn't turn up to 3 meetings or didn't answer 3 phone calls, which has happened, isn't good enough. So that's why we're pushing it. But then you do get a bit of game playing by local authorities using other measures, like fail to make contact is another way that you can discharge the duty. So then they don't use the duty to cooperate bit. So it's a problem, and it's a bit we're lobbying on and gathering more and more evidence from folk that have been through the system. Yeah.
Thank you.
We had a bit of a chat before, which was great. There's a lot of emphasis on the supply side solutions, probably most people here. What about the demand side and the universal duty to assist? What about a universal basic income?
Yeah, we did have a chat before. I love the idea of a universal basic income. Where when I talked through that framework of prevention, the first one that is universal prevention is the key cause of homelessness is poverty. The driver of homelessness is poverty. And if you've got a universal basic income, then you go a long way towards addressing that. But in practical terms, how the legislation is being used, there's a whole load of funding that's there to be used very flexibly, and it's being used to top up incomes, to enable people to access the markets. But you do have to be mindful that you've got to find sustainable solutions. So you can't be just putting sticking plasters on it. So the funding, if you're saying we'll cover you for 3 months' rent, what you don't want is that at the 4th month they've got no other source to top up their rent. So it has to be affordable solutions that you're putting folk into. But yeah, I'm a big supporter.
Yes, of course.
I was just interested in one of your points on what you could do better and around eviction of people into homelessness, which is something we grapple with here. So has there been any start on that work and any evidence so far?
No, it's hot off the press. We've had a study by some other good colleagues that basically looked at, and I don't know if you've got this in Australia, our different housing associations, and you've almost got the league table of highest rate of evictions down to lowest. And so there's talk of it came up and it was proposed at a conference, and the minister responded to say, absolutely, this is what we. But this is something we want to look at. But that's in the last month that's hit the ground. But there are unintended consequences potentially of that, which you might talk to Ed in a bit. I don't know.
I might have missed this bit, but in our country we have 3 levels of government, all with different perceptions of what their duties are. So when you say duty to assist, clarifying that is difficult. Did you start with the same mess and then bring it into one?
It's a really good point, and actually it makes the direct transfer of the policy really tricky if you wanted to just parachute it in, because of the structure of government here, and you wouldn't want to do that anyway. It's a bit messy in Wales. We are a country, and I'll keep saying that, but certain things are not devolved. We do not have welfare, which is fundamental, because that's how folk are going to pay for their houses. And we've got a Westminster government that's decimated our welfare system. So whilst we're trying to bring in innovation, they're taking away the money for folk to survive. And we've had a pretty damning report by the UN Rapporteur on that. So we don't have those powers, that's problematic, but we do have housing powers. So when Welsh government legislates, the local authorities have to do it. They don't have the control to say no. Whereas you've got the state system, so different states will have different policies. And the best thing that I can say is that we've had the conversations a little bit earlier with Canadian colleagues, and so what they've done is they've just gone to a city. So they've gone to a city and said, look, here are the principles. Let's work bottom up. Let's not impose it. Let's say, here are the principles that seem to be working. And we've been out a couple of times, and the community is saying, well, if we work to those principles, what would it look like in the Hamilton context? And so they're arriving at it in their own version. I think that's probably the approach you'd have to take here. In the Welsh context. Okay, I'm not sure they've got to the funding. So the pilot is being funded through academic funding, but it's the local community organisations that are saying, yeah, we agree with this policy and we'll fund it, because they have homelessness funding. Both in Canada, you get a bit from federal, but you also get a bit from community level. Absolutely, and it was a lesson, so we had to model the financial impacts of this thing, and it was like sticking your finger in the air, and I came up with one figure, and local government quadrupled it and times that by 10. It was just crazy numbers. We didn't know where it was going to land. Welsh government said, right, here's transitional funding, and it was good, and they realised that that's not transitional funding. That's got to keep going, and they've kept it going. Yeah.
So, question here, and then I'll go over here.
Andy Knight of Cardiff University. Thank you very much. That's very interesting. I'm interested in the prevention statistics that you presented. And if I understand correctly, these are people who are homeless at that point, and then 70% of them do not become homeless because they go into 6-month accommodation. How many of those people would not, is the argument essentially those 70% would go into homelessness otherwise, or how many of them would not have gone into homelessness?
That's a really good question, and we don't have the answer, because we're rubbish at random control trials in the UK, which would have been a way to answer that. What's the counterfactual? What would have happened if we had not intervened? And we don't know the answer. But sorry, I'll go on again. But that's the nature of a universal service. It says, actually, you've come in with a housing problem. We're going to do the minimum it takes to make sure that the housing problem's gone. And we don't know what percentage would actually have become homeless, what percent would have self-resolve. We don't know the answer to that. And in some ways, there is an argument that says that doesn't matter. Because in a universal service, you do the minimum to make sure that the challenge, the problem that person's facing has gone away. And in some ways, don't call it a homelessness service, just call it a support service, housing support service.
It's not as if the service is going to cost more than it did before, but you're not helping more people.
Well, you are helping more people. There are people that weren't being helped before that had a housing problem. They may not have become homeless, but they had a housing problem that you've now resolved. Yeah.
Had a question up here?
Thank you, Peter, for your presentation. Having worked with Swansea City Council, I know some of the challenges in this space. You've had 10 years of austerity in the UK, and to Sally's point around funding, but when pitching to the Welsh Assembly, did you make the argument that there are obviously health benefits as well associated with this? Because there's been research here in Australia back in 2017, I think it was, every dollar spent on homelessness is a $2.70 saving for government. Did you pitch that kind of argument?
That's really a really good question. And if we were in the States, you would never get this policy through without making that argument. We made it in England. We didn't have to in Wales. And I'm really clear about that, is that we sat down, and when we did the review, they said, look, Pete, we need a more just and fair system. Go away, do the review. The only condition is there's no more money. Now that's a fib, because they found some transitional money that's still going. But it was a social justice argument, and you can do that in Wales. Government will make a decision based on social justice, and if it costs a bit of money, they'll run with it. And that argument still flows now. I'll tell you a quick anecdote. So we sat down with a major research institute that's about to stick a load of money into research, and they said, what should we be funding? We don't have much at all in the UK on cost-benefit research. It was me and a Welsh Government colleague, and I said, no, there's loads we don't know about prevention. The sorts of things you're saying, Would those folk have become homeless otherwise? They're questions that we might want to answer. But loads of our interventions, we don't know which are the most effective. I'd much rather answer that question than the cost one. And the director of this institute turned to the Welsh government official and says, well, yeah, that's an academic, though. They don't worry because they haven't got to pay the bills. But what about government? And the Welsh government official still said, no. I'd much rather know what's working than the cost benefits. That's not a right or a wrong thing, but that's just the context in which it happened.